Welcome to the webinar. I'm your host with the most, Susan Bratton, intimacy wellness expert, and I'm here with my very good friend, Dr. Judson Brandeis, board-certified urologist and director of clinical excellence for GAINSWave. Hi, Judd.
Oh, hi, Susan.
Great to be back in the
fantastic
saddle of
to
the
be
webinar
back.
again. I know. This is our third one.
It is our third.
Yeah, this is our third. So
Great things come in threes.
they do. This is the third time's a charm webinar with Susan Judd, and we are definitely going to stay until we get all your questions answered today. We've got a number of things to talk to you about. We're going to start off with the very first thing, which is what causes erectile dysfunction. And then what are the things that we recommend for solving or reversing erectile dysfunction? I know we're going to get some questions around prostate issues, premature ejaculation, delayed ejaculation. And remember that today is sponsored by and in support of our partner, GAINSWave. So we're going to spend a lot of time talking to you about what GAINSWave is, how it works, why we love it so much, and why we are associated with this excellent treatment, not only for erectile dysfunction, but for just generally keeping your hard-on, your erection firm, hard, full of blood, and staying hard. So, Judd, do you want to start off with the most common causes of erectile dysfunction? Because I think that, and kind of how an erection works, and when it doesn't work, what it most likely is.
Exactly.
Yeah.
You know, I mean, that's a great place to start. And you brought up the most important part, which is blood. It's blood flow to the penis. And so the critical aspect is getting blood from the heart all the way down to the penis. And it doesn't seem like a big deal, but if you think about circulation, the first place when your heart beats that the blood goes is back through the coronary arteries, back to the heart, and then to the brain, and then to the lungs, and then to the liver, and then to the kidneys, and then to the intestines. And then your blood vessels split left and right, and then they split again. Part of it goes to the leg, and part of it goes to the pelvis. And then that branch that goes into the pelvis goes to the buttock muscle, to the tailbone, to the bladder, to the prostate, to the vas deferens, for the rectum. And the very last branch of the last major artery is called the internal pudendal artery. And that goes to the penis. And so if you think about it, it's a lot of times the first thing guys think about, but the very last thing that gets blood.
Yeah, it's the end of the line.
One of my favorite, I was giving a talk at a men's club the other day, and some guy raised his hand and said, "How come God just didn't put it right here?" But that path that the blood has to go to get to the penis is really long, and then the blood pressures in the penis have to get really high. So blood pressure in your aorta and your heart may be 120 over 80, but the blood pressures in the penis have to get 200, 300, 400.
Wow.
And so it has to get even higher than in your systemic circulation. And the way it does that is that it fills up the spongy tissue in the penis, and it exerts a tourniquet effect on the veins. So usually arteries pump blood in, veins send blood out. But in the penis, you want to get to the point where the spongy tissue in the penis fill up to the point where the venous backflow is blocked. And so
say that in a different way. The venous backflow is blocked, because I think the largest majority of erectile dysfunction comes from something called venous leak. So explain the venous backflow and the endothelial cells, the smooth muscle tissue. Go a little bit deeper into that.
Absolutely. So arteries have muscular walls. And so when your heart pumps, think about it this way. Your heart is a pump. It's about that big, but if you lined up all the blood vessels in your entire body, it would be 60,000 miles. It would circle the world twice. And so the way your heart actually does that, pump blood 60,000 miles, is to have little hearts in arteries, meaning that the arteries in your body have muscular walls, so the arteries also pump. So that's why you have a systolic and a diastolic blood pressure. And that's why you feel a pulse in your extremities, because the arteries are actually squeezing also. And so the arteries squeeze blood into the penis, and the venous blood is a more passive or more gravity type flow. And so that can actually be constricted or cut off, or your body exerts like a tourniquet like effect on that blood. So the artery is still pumping blood in under pressure, but the venous blood is more of a passive flow, and that gets constricted. That gets blocked off. And so if you're not able to generate enough pressure into the penis, then you'll have a full penis, but not a rigid erection.
Yeah, so it's like you get enough blood in there that it locks, and then the blood stays in and can keep pumping in. Is that right?
Exactly.
And so then if you can't lock it in, it's just bendy.
Exactly.
Uh-huh.
So
I think is that
there's
the
a
number one
question.
thing?
Exactly. There's a question like Mike is a type 1 diabetic for 52 years, and diabetics clog up their blood vessels and they have problems with their nerves, and so diabetics have a really high incidence of erectile dysfunction because of that. Now, there are a number of reasons why you can't get blood into the penis. The most common would be what we call atherosclerotic heart disease, or blocking these blood vessels. In fact, I have a little...
We have so many props to show you.
We have a lot of props. So this is a blood vessel when you're younger. And as you age and eat an American diet with donuts and
French fries
and hot dogs, what happens is you'll start to get blood vessels that begin to get blocked off until they get so blocked off that you're not able to generate enough blood pressure into the penis to exert that tourniquet effect. So most commonly, it's something that affects the opening or the width of blood vessels, like smoking, like diabetes, like eating poorly, anything that causes heart disease, like Stephen's talking about eating healthy but and not much fat, but that's the issue, is that people eat too much fat, too much cholesterol. Okay, now the other things that can affect that are nerves. So getting an erection is a combination of a signal, which is mostly nitric oxide, and pipes, blood vessels. And that's actually what GAINSWave can really help you with, is opening up and growing new pipes. But that's the other form of erectile function, is what we call neurogenic, or nerve related. And so men who've had a non-nerve sparing prostatectomy, or men who are diabetics that have neuropathy, or people with multiple sclerosis or stroke, will have neurogenic erectile dysfunction. So the signal, it's like not having someone cut the wire. So even if you turn the switch on, the light bulb's not going to light up. Other people have endocrine or hormonal issues. So if your testosterone is super low, you may not even want to feel like you want to have intimacy. And then there are other issues like what we call iatrogenic, or medication related.
Iatrogenic, that's medication.
So like patients who have heart disease that are on blood pressure medications that lower blood pressure, or selective serotonin reuptake inhibitor like antidepressants will also give you erectile dysfunction. And then there are folks that have psychogenic erectile dysfunction. So they get so nervous or so anxious about
performance
that they produce stress hormones. And stress hormones, we could talk about in a little bit, basically constrict blood vessels, which reduces erectile function.
So you could have any number of these issues, right? So let's talk about the 5 parts to pretty much reversing any and all of these issues. The first thing would be testosterone, right? Checking your testosterone levels, making sure that they're adequate. Looking at series of GAINSWave treatments, which we're going to explain. Nitric oxide, supplementation with a nitric oxide supplement that will give you that blood flow, relax those muscles, vasodilation. What else? You like to prescribe Viagra,
Absolutely.
Levitra Cialis as part of the process, and then there's one more thing. The vacuum erection device. And PRP. So there's 6. There's really 6 things that you can do in combination, depending on your situation, to reverse or mitigate the effects of living the 21st century lifestyle.
Yeah, that's a great summary. And the way I kind of organize it in my own mind is really testosterone comes first, meaning that if your testosterone level is too low, you're not going to feel like being physically intimate with anyone anyway. And there's something called the ADAM, or ADAM, the androgen deficiency of the aging male, meaning that when you're younger, your testosterone levels are 8, 900. As you get older, say you're in your 70s, your testosterone levels might be 300, might be less than 300. Now you go to the doctor, you get labs, you get the whole big panel of labs, and your physician says, oh, everything's great, everything's normal, and your testosterone level, yeah, that's normal too. But it's normal for a 70-year-old or a 75-year-old. I had a patient the other day, he was 80. He's like, well, for 80, it's normal to be dead.
Yeah.
He's like, I don't want to be dead. I want to be alive.
With the hot young girlfriend?
Yeah. So, normal for 70 or 75 or even 80 may not be where you want to be. And so if you want to have energy, if you want to have better mood, if you want to build muscle, if you want to get rid of fat, if you want to have libido, if you want to have better sexual function, boost testosterone. Mm-hmm. And there are a number of supplements that are testosterone boosters, but really the ultimate is testosterone replacement. And I would encourage anyone over the age of 50, if they're feeling low energy, if they're having trouble building muscle, if they're having trouble putting on fat, to consider just getting a simple blood test, which is the testosterone level, and then go to your physician and consider testosterone replacement.
Yeah. So there's a couple things about that too. I think that the standard of care, which is not the optimal standard, it's just the standard of care, gives you a blood test for testosterone. Right. But you need a 4-point dried urine or 24-hour test to see not only what your free testosterone is, but what your bound testosterone is. And then you need to not settle for the standard of your age, but to look at getting something, maybe you're at 200 or 300, and that might be normal for your age, but you want to get into the 4, 5, 6, 7, 8, 900 range. Many men are over 1,000 in their testosterone, and they feel really, really good. So that's something that you have to have more than one test and manage. And the other piece of it, which Judd was saying, was testosterone supplementation is helpful because it gives your body, just like today's modern foods don't have all of the vitamins and minerals that they used to because of big agriculture. These are the foods that we end up eating a lot. We're missing a lot of vital nutrients. Just a little thing like boron, which is a tiny little trace mineral that could be deficient in your diet, is what binds to the protein in that free testosterone and allows it to jack into the testosterone receptors so your body can actually utilize it. Things like vitamin D and magnesium. Very simple things that are in vitamins that you might be missing. So starting with the baseline of good nutrition and good exercise, and then doing the right tests to get the data that you need, you can tell your doctor what to order for you if they're not already ordering those types of tests. And then you can learn how to read your own numbers, and you can ask for testosterone supplementation. Will you just talk briefly about like BioT, the pellets, the creams, and things like that, the different ways that you can do testosterone supplementation?
Absolutely. But I think it's important what you were saying. We have a model in this country of sickness.
Yeah.
Meaning that we treat sickness to get people back to sort of normal. But there are a lot of people out there that are normal that want to get better.
Yeah.
They want to go from good to great. And so boosting testosterone from a quote normal level to some level that will get you to go to great is really essential.
And I've noticed that there are a lot of men who, you might be one of them, where you're thinking to yourself, oh, I don't know, I don't really even have the energy to get my testosterone checked.
Those are the guys that actually really need
the testosterone.
You can even skip the testosterone level, just go straight to testosterone.
Exactly. Don't even try.
If you don't have the energy to get to the lab,
you need it. Yeah.
Do not pass go. Do not collect $200.
If you don't feel like you have the drive, if you're not horny, if you're feeling nervous, or there's anxiety, or you don't have the energy you used to have, that is very indicative of low testosterone.
Absolutely. And so in terms of, you asked me a question that how to replace
different
testosterone.
Types of testosterone.
So there are a number of different ways. Yeah. The thing is, you can't take testosterone as a pill.
Yeah.
because your liver breaks down testosterone and sometimes it can be toxic. And so you have to get it directly into the bloodstream. And so you can either inject it through your skin, either into the muscle, which is the least expensive way, or with a new medication called Xiosted, which goes into the subcutaneous fat. The advantage of intramuscular injection, it's the least expensive. It will give you good levels, but your levels will kind of do a roller coaster, meaning that for a day or two after initial injection, it will be high, and for a couple days before the new injection, it's low. But the other thing is that it's not real testosterone. It's something called testosterone cypionate. And so what that is, it's a synthetic molecule that the drug companies have come up with that has a receptor binding site that looks like the receptor binding site for testosterone, but it's actually not really testosterone. The issue is that real testosterone or bioidentical testosterone, the drug companies can't patent. Only the big guy in the sky has the patent to the real bioidentical testosterone. And so pharmaceutical companies, they can't make any money on it. If they can't make any money on it, they don't want to make it. And so compounding pharmacies will then begin to make things like bioidentical testosterone. And so another form of testosterone is what we call transdermal, or testosterone that goes through the skin. So you can put this on your shoulders, on your buttock, on your axilla, on your legs. Now, testosterone is a relatively big molecule, and the skin is a really tight barrier. And so it's hard to get adequate amounts of testosterone to get through your skin into the blood supply. You are able to do that, but the levels that you get maybe are, in my experience, are 4, 5, sometimes 600. They're not the levels that guys come back and clinically will say, I feel great. I have great libido. I'm building muscle. I'm shedding fat. My spouse and my kids have noticed a big difference in me. That's just to kind of get you back to normal. We're talking about going from good to great. Now, there's another form of testosterone replacement called BioT, or pellets, that are put in subcutaneously just below the skin on the hip or the buttock. And what those do is they slowly release testosterone over 4 to 6 months. And so you get a tiny little puncture. They slip these pellets in, which are about the size of a grain of rice. They just put a little Band-Aid on it to close the skin. And that will give you really high levels, 900, 1,000, above 1,000 for about 4 to 6 months. And my patients that have had BioT pellet replacement really have had tremendous results. I mean, really tremendous energy. And
it seems like BioT right now is the market leader because it's not synthetic. It's bioidentical, right? So it's bioidentical. It's, you set it and forget it for a while, which is nice. You don't have to give yourself an injection. You don't have to worry about the creams. But I would say also one other option would be the compounded testosterone in a cream that's put in rectally. You just wipe a little bit in the rectum every day. A lot of guys are like, oh, I don't want to touch my butt, but we're going to be getting into your butt later. So don't be afraid of your butt. It's your own butt. It's part of your body. It's very good mucosal tissue. So that's another option too. If you're afraid to get the pellet because you're like, well, that's a pretty big commitment and I can't really dose up and down. So I think that's another good, very plausible alternative for men that aren't, butt afraid.
Right. I mean, there are other forms. You can, there's a nasal.
And there's troche, sublingual.
You can put sublingual, anything that avoids the liver and goes straight into the bloodstream.
Yeah.
Is
all right, good. So I think we've at least gotten started on testosterone. And the next thing I think we should talk about is I think we should really get right into GAINSWave because a lot of guys have a lot of questions about GAINSWave on here. And I was wondering if now Adrian and Tim are here and they're helping us with the webinar. And I was actually wondering, guys, if you could kind of find the GAINSWave questions and pin them for us. So first, you want to start the machine?
Sure. Absolutely.
First, we're going to show you what the GAINSWave looks like. We're going to tell you how it works, why both of us think it is the single best thing you can possibly do for not only reversing erectile dysfunction, but not waiting until you get it, but actually keeping all that tissue in good shape. There's this concept that's called sexual regenerative therapies or treatments. regenerative medicine is a category of healthcare that uses your own body's healing abilities. Just like when you cut your arm and it scabs up and it heals and the skin grows back. What you can do is you can actually stimulate new tissue growth by using some of these technologies that we're going to explain to you that include GAINSWave and PRP, or platelet-rich plasma, which is healing factors taken from your own blood. And we love the GAINSWave together with PRP. Now, the other thing that we will do is we will talk to you about what is the luxury, what is everything you can do? Because like we started out saying, okay, here are the most common causes of ED. These are the things that we recommend that work synergistically and complementarily together. But we also understand that there are people who are on a budget. So there are some people who are like, I'm doing it all. I can afford to do it all. My erectile function is super important to me. I want to have a really strong, firm erection my whole life. And I want to make sure that I'm not waiting until things don't work anymore. As I age, I'm supplementing my testosterone. I'm going in for my annual GAINSWave treatments. I'm using PRP. I'm doing the things that are going to make sure that I stay young and vital and have a great erection before I have to reverse problems. But regenerative medicine, which is what we're really talking about here, bioidentical testosterone is exactly the same as the testosterone you make in your body. You're just doing what's called exogenous, using exogenous rather than endogenous, right? Something you're making versus something you help give to your body. We're going to talk about supplementation. Just like I mentioned, boron, a silly little trace mineral that your body needs and might not have enough of, vitamin D, magnesium, things like that. We're going to talk about citrulline and the nitric oxide pathway. These are all natural things. We're going to talk about GAINSWave, which stimulates new tissue growth and knocks that nasty plaque off of your blood vessels. And we're going to talk about PRP, which comes from your own blood. So everything that we're talking about on this webinar today are things that either are already within you that heal you or are just exactly like the things in your body, as well as vacuum erection devices using a vacuum to get that blood flow into that penis so that it keeps the blood vessels. You know, what happens as you age is your blood vessels start to recede. You wrinkle, you shrink, you lose muscle tissue, you lose blood supply. So just as Judd started at the very beginning saying blood flow is everything for erectile function, it's also everything for cognitive function. It's also everything for keeping your sarcopenia at bay. Sarcopenia is the muscle loss you get from aging. So everything here is natural and really focused on keeping you just like thrumming with life and thrumming with desire. Because without that, thrumming like boom, 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 getting that blood flow going. Because those are the things that we want to do. We don't want you to have to rely on pharmaceuticals unless that's something that can just support you gently. And many guys don't want that at all. They don't even want to try anything. They want everything to be natural.
Well, so, you know, the interesting thing is you talk about rejuvenation.
Yeah.
There's another term called prejuvenation, meaning that...
Oh, I like that.
Yeah. Rejuvenation means that you've kind of lost an ability.
And you have to fix it.
And then you have to fix it. It would be even better. An ounce of prevention is worth a pound of cure. And men begin to get erectile dysfunction or reduction in erectile function in their 40s.
Yeah.
And so there are things that you can do, including GAINSWave, including a nitric oxide booster, and including being heart healthy, that can forestall or prevent the initiation or the beginnings of erectile issues.
I like that. Every time I do one of these webinars, I learn so much from Judd. He's amazing. One of the things I also want to tell you is that GAINSWave gives me a promo code. And when you go to gainswave.com and you look up in the directory, there's a directory that you can click on in the upper right-hand corner of the website. And when you go there, if you put in, if you find GAINSWave providers in your area and you select one of them, and you fill out the form for them to call you so that you can have a phone consultation to see if you're a candidate. If you put in the comment box the promo code BETTER, BETTER, and you decide to do GAINSWave treatments, you get a 7th treatment for free. And a 7th treatment for free is fabulous. I mean, if you're going to get GAINSWave, don't forget to give that promo code somehow to them so you get that extra treatment, because every single treatment you get improves the blood flow and the firmness and the quality and the duration of your erection. It is good for you. It's kind of like an extra boost. So definitely get that as well. And I'm going to mention that a few times in the webinar because I really want to make sure that if you're going to do it, you'll get it.
A lot of people say, well, how does it work?
Yeah, let's do that now.
You know, and even honestly, to be perfectly honest, I was very skeptical myself when I first read about it and I first saw the results and I went down to GAINSWave in Miami to get training. I was extremely skeptical that it actually worked. I come from a very traditional, scientific, research-based background, and so I began to delve deeply into the literature and into the clinical literature. And so what actually happens is a shock wave is generated from the shockwave device. And so within this device, there's a little bullet that bounces back and forth, and it hits this strike plate, and it sends out what's called a shock wave. A shock wave is different than a sound wave. A sound wave is a nice, gentle, sinusoidal wave. So if you go to a movie and stuff is blowing up and you feel that vibration, that's a sound wave. These are shock waves. These shock waves actually come from real explosions or the crack of a bullet or the crack of lightning. And it's an intense wave of energy. And that intense wave of energy can be harnessed, for example, to use to break up kidney stones. That intense wave of energy can be used to break up scar tissue, like in Dupuytren's contractures or in Peyronie's disease. But if the energy is lowered, that intense pulse of energy, if it's repeated over and over again, can develop what's called endothelial microtrauma. So endothelium is the inner lining of blood vessels, and it's really like a critically important part of your body. It maintains blood pressure, it releases nitric oxide, and when you have microtrauma of the endothelium, what happens is stem cells are activated. Stem cells are cells in your body that can become other cells. And contrary maybe to some people's perception, you have stem cells all throughout your body. So when you heal, when you grow new tissue, stem cells are used to produce that new tissue. In addition, you have growth factors, including vascular growth factor or VEGF. And so your body generates an inflammatory response from the shock waves, which is a healing response. That healing response activates stem cells and causes the release of vascular growth factor. And this causes what we call neoangiogenesis, or the growth of new blood vessels. And then nitric oxide is released from the endothelium, causing those blood vessels to open up. Now, how do we know that?
I don't know.
You know, do you think we just went around with this and did shockwave on a bunch of guys and then cut their penises off and sectioned them up? Poor Tim is like mortified.
Doppler
So
test?
actually, yeah, right in our backyard, just on the other side of this bridge right here at UCSF, there's a Dr. Tom Liu who figured out this on rats. So next time you're in San Francisco,
do rats have like little
they
penises?
do have little penises, and what a job to be doing shockwave therapy on rat penises. I don't think there's a
rats, though.
yeah, exactly.
And they're very similar to human, like they have the same kind of tissue. And,
pretty much, yeah.
Oh, that's amazing.
So if you're in San Francisco and you see a bunch of dickless rats, you can thank them for participating in the
Rat.
GAINSWave study. I think that's the same cast of Ratatouille. You know, after they couldn't have sex, they took up cooking. But anyway, that's the science behind how GAINSWave works.
All right, hit me with it.
Okay.
You have it turned on, right?
It is.
All right, we have it down here on the floor because we don't have a ton of room in the studio. So I've had GAINSWaves. I've had the female version, FemiWaves, a number of times. I absolutely love them. But you can just do it to my arm if you want. Yeah. Can you see okay? Can you see us? Yeah. So you can hear it.
Okay.
That's it.
See, when it goes through soft tissue, it just passes straight through.
Doesn't hurt.
Now, if it hits the bone,
Yeah.
that's a whole different story.
Yeah. So it literally doesn't hurt. I think,
Yeah, I mean, if you do it with your penis.
yeah. Hold it up higher.
No, that's not my penis.
Hold
That's
it right up
that's
here.
a model.
Yeah, right. It looks like you're in this. You're
This is
tricking
not-
us. You're like,
yeah,
you're
this is
doing
not
it
a-
with me.
This is R-rated. It's not X-rated. So you go up the shaft of the penis on both sides.
Oh, that's
Can you hold my
yes,
penis?
I will hold your penis.
So this is the deep cavernosal artery on the inside of the penis. And then you also want to get the internal pudendal artery on both sides. And the treatment lasts, the treatment lasts about 15 or 20 minutes. It's not uncomfortable. Some guys need some local numbing cream.
Yeah, you just put
But
benzocaine on there or something,
no
right?
injections.
Yeah. Although
Yeah.
the PRP is an injection, but that
PRP
doesn't
is
hurt
an
because you already have the
injection.
benzocaine on there.
Exactly.
One of the things that I really like about the GAINSWave is, of course, it takes care of the external penile tissue, but you also really get down in there to that buried shaft. I mean, is it about 50% of the penis goes into the body?
Exactly.
It's about half,
Half
right?
the
So
penis is
half
on
is
the
in and
outside.
half is out.
So if anyone ever asks you how long your penis is,
Double the number.
double the number.
And then you also are taking it up underneath the testicles in the perineal area. You're getting all that perineal area. And I know that one of the things that you've also been doing is GAINSWaves on men who've had nerve sparing prostatectomies.
Right.
So that is rejuvenating that nerve tissue. Is that right?
It is. Well, it doesn't. There's
How's it
some
work?
evidence that nerve growth factors are released in addition to vascular growth factors. But the primary result is to increase the vasculature, to grow collateral circulation.
Uh-huh.
But you bring up an interesting point, because not only does it work on men with nerve-sparing prostatectomies, but for men who've had radiation therapy for prostate cancer, because radiation
It blew everything out.
Well, radiation causes stenosis, or narrowing of blood vessels.
Oh, really?
Yeah,
That's interesting.
And so GAINSWave causes opening up of blood vessels, causes the growth of new blood vessels. Same thing as diabetes. Diabetes causes narrowing of small blood vessels. GAINSWave causes opening up or growth of new blood vessels. And also for smokers, exact same thing, causes atherosclerotic disease or narrowing of blood vessels in the kind of intermediate to small range. The blood vessels to the penis, right, are 1 or 2 millimeters.
Okay.
The blood vessels to the heart, the coronary arteries that everyone always talks about, they're 3 to 4 millimeters.
Mm-hmm.
So these blood vessels in the penis are much more likely to get clogged than the blood vessels in the heart. And that's actually a really important point for men who, say, are in their early 50s and they're beginning to develop erectile dysfunction. The data shows that within 6 years to 7 years, 1 out of 6 of those men will have some major heart issue, whether it's a heart attack or a stroke or some sort of coronary intervention. So if you're in your 50s or even early 60s and you're otherwise in pretty good health, but you begin to get erectile dysfunction, it's important to tell your primary care physician or your cardiologist or your urologist, because maybe you can get a simple heart scan to get a calcium score, and maybe your penis will actually save your life.
Also talk about, wait, before you go with that, bring the penis back. Let's talk about Peyronie's, because Peyronie's, more and more men are suffering from it. So Peyronie's is the injury of this tunica albuginea, right? Exactly. I learned that on our webinar. We're number 1. I learned how to say.
Have you been practicing pronouncing that?
Heavens, yes. So a lot of men from either rough sex or God knows what, injuries of all kinds. As a matter of fact, one gentleman had an erection and one of his friends kicked his penis and broke the vein in his penis. And he's in Pakistan, and he has something called penile artery or arterial insufficiency, which you said is basically just
like a severe blockage.
A blockage to that artery or a break in that artery. So there can be damage to the interior parts of the penis as well as to that tunica albuginea, the covering that holds everything in there, the little like muscle. I think about it like that. Yeah. Does it look kind of like that silvery tissue on like a tenderloin on a piece of meat? Does it kind of looks like that, doesn't it?
Similar.
It's like that kind of almost shiny, silvery kind of thing that holds everything together. But that'll get a cut or a break or a damage of some kind.
Well, 80% of the time, guys don't even realize that what happened or that it has happened. I think guys get erections at night, they roll over on it, it bends a little bit.
Gets a kink.
They wake up, they go back to sleep, but it gets a little kink, and then that micro injury develops into scar tissue. Because the lining of the tunica albuginea is really strong. It's made out of collagen. That collagen is lined up. If you look at collagen under the microscope, it looks like a box of spaghetti. You know, before you cook the spaghetti, it's all lined up. Now, scar tissue under the microscope looks like spaghetti after you've cooked it. It's all scrambled up. And so normally when you get an erection, that collagen slides alongside each other. But in the situation of a scar tissue, what happens is all that scar tissue is scrambled up. And so that collagen is strong tissue, but it locks up and it doesn't stretch. And so if one side of the penis, like say there's a plaque right here, which is the most common place for a plaque, and this side is still stretchy, what it'll do is it'll curve upward.
Okay. So now how does the GAINSWave fix that?
Exactly. So first of all, you want to do GAINSWave to improve erectile function, because you want to get good erections, especially at night, because that will stretch your penis 30 to 60 minutes at night. But then the other thing to do is to directly focus the shock waves, the GAINSWave shock waves, directly onto the plaque of the penis. But the other really important part of that is now you've broken up the peptide bonds between the strands of the collagen, but you have to stretch it out. And so the way to stretch it out is to use a vacuum erection device, a penis pump basically, to stretch it, to pull out that curve, to stretch those collagen fibers back in the direction. And patients in my office that have undergone this will say that they gain about a half an inch to an inch of length back that they've lost. You know, that's one of the real bummers of Peyronie's disease, is you get anatomic shrinkage of the penis, either half an inch, 2 inches. And that's a big deal for guys.
Well, that's the other thing I like. The GAINSWave, the PRP, and the penis pump together, they all work to reverse the natural aging process that creates shrinkage in your penis. So your penis is shrinking as you age. That's the bummer. And the even more sad thing is that for women, our tissue in our vaginas are shrinking as well. But when we shrink, our vaginas get bigger. And when your penis shrinks, it's called atrophy. When your penis gets atrophied, it gets smaller. So now you've got an even smaller penis in an even bigger vagina. So there's no grip. You're losing the grip. So you're losing the pleasure. It doesn't feel as good as it used to. And so for women, we have these intravaginal devices that recollagenate the tissue, very, very similar to GAINSWave. GAINSWave works on the outie, and these devices work on the innie, and that works really well for plumping up her tissue and getting more blood flow and more tissue growth to her vaginal canal. The same as GAINSWave is getting more blood flow and more tissue growth to your penile tissue. And then that keeps everything nice and tight and orgasmic, which is fabulous. We're so lucky to live in today's age. Now, we have a number of questions. I see some from Brian, Steve, Roland, Kenneth, Anthony, Lynette, Dawn, Russ, and another Steve. So we're going to just go through these in order and answer some of these questions. And then we're going to continue on because we've got lots more stuff to tell you. We haven't even really gotten to PRP. We haven't gotten to really anything about penis pumps particularly. We haven't gotten to the supplementation things we want to talk to you about. So the first question is, Brian, what's your opinion on Caverject and GAINSWave? And he's also had a TURP surgery. Will GAINSWave help him? So let's take those separately.
Absolutely. Yeah. So a TURP surgery is called a transurethral resection of the prostate.
Did you bring any of that in your toys?
Yeah, look.
Oh, yeah, he's always got his toys here.
And so a transurethral resection of the prostate means you go through the urethra tube that you urinate through, but you're asleep. I don't want to scare you. You should be asleep for these procedures. Okay. So transurethral means you go up through the penis, and then you scrape out the tissue on the inside of the penis. So
inside of the prostate.
Inside of the prostate. Sorry, my bad.
Oh, no worries.
And that tissue on the inside of the prostate is what makes semen. So a lot of men after that operation say that they have less ejaculate, or what's called retrograde ejaculation, meaning that the ejaculate goes up into the bladder. But since the nerves live on the outside of the prostate, that shouldn't affect your ability to get an erection. So erections are blood flow and nerve signal, and it really has nothing to do with the inside of the prostate.
Will the GAINSWave help with anything regarding the prostate? Does it help with that gland at all?
There's some evidence that you can use it for chronic pelvic pain, which may be related to the prostate. And that's some research that's ongoing in my lab and a number of other people's labs.
Good.
So the short answer is yes. The longer answer is it doesn't really, the prostate doesn't really factor into erectile function. It just factors into producing semen. And so a TURP will cause the reduction or loss of semen. Now, Caverject is injection of a medication into the penis. So this is for men.
Is that like Trimix?
Exactly.
Oh, it's Trimix.
It's a brand. It's alprostadil, which is one of the medications in Trimix, but it's an injection directly into the erectile body of a medication that opens up blood vessels. So if you're failing Viagra or Levitra or Cialis and things aren't working, but you have some decent blood supply to the penis, you can inject those medications, and for half an hour, an hour, 2 hours, depending on the dose, you'll be able to get an erection. Now, by growing collateral blood vessels, GAINSWave will help you respond to Caverject. So the short answer to that is yes, and I have actually a number of patients that have been on Caverject and Trimix, and using GAINSWave, I've been able to get them back to where oral medications will help them.
Good.
So
that's what I would hope.
Only the big guy in the sky will get you back to the point where oral medications you don't need. But for someone who's on injection therapy, and it's not a great thing to have to inject a medication into your penis every time you want to have an erection. Yeah. It's a miraculous thing to have GAINSWave and not to have to do that anymore.
There's another thing called CaverStem, which is a Swiss company that does harvesting of the iliac stem cells, the hip bone stem cells. They basically take the stem cells out, flip you over, and inject them into your penis. And that's kind of like PRP on steroids, really. And that's probably the most expensive thing would be like either CaverStem or mesenchymal stem cell injections. So there's definitely a series of things to do in the right order to work your way up to some of those things that are, really, really expensive. Okay, so should someone get the P shot after using GAINSWave? You know what? Let's hold on the P shot stuff, because I think we should explain what that is. So let's parking lot all the P shot GAINSWave combo questions for a second. So let's go to the next one, which is Kenneth from London, Ontario. He's told not to add testosterone when he has an enlarged prostate. And I did see a number of people say, my doctor told me if I do exogenous testosterone, I'll get prostate cancer, or it'll give me cancer, or what have you. So
so exogenous testosterone does not give you prostate cancer. Okay.
Yes.
And replacing testosterone in men with low to intermediate grade prostate cancer is not dangerous. The only danger is if you replace testosterone to high levels in men with aggressive prostate cancer, it can cause the acceleration of the growth of that prostate cancer. So that may be something that you don't want to do. Now, for men with really big prostates, it will continue to grow prostates. Now, testosterone turns into what's called dihydrotestosterone, which is what works locally. And so you can take a medication like finasteride or Proscar or Avodart or dutasteride, and those block the conversion of testosterone to dihydrotestosterone, so that testosterone basically just goes where it's supposed to go, into places like your muscles and your heart and your brain, and it doesn't get broken down into DHT. And so if you do have an enlarged prostate, you should be followed by your primary care doctor or your urologist. You should be appropriately medicated, but also you might want to consider, say, taking something like a 5-alpha reductase inhibitor like Proscar or finasteride.
Could you just take DIM instead? Do you have to take a pharmaceutical?
Yeah,
is it strong enough?
DIM basically prevents testosterone from going into estrogen. So for men who are taking testosterone replacement, who are developing high levels of testosterone, the difference between, everyone thinks like, well, men are from Mars and women are from Venus. They're like, testosterone and estrogen are wildly far apart. But in actuality, the only difference between a testosterone molecule and an estrogen molecule is one single hydrogen. They're almost exactly identical molecules. And so testosterone can get what's called aromatized, which means it gets converted into estrogen. And so you don't want to have too much estrogen if you're replacing testosterone, because then it'll overdo both the male and the female characteristics. And so you take something called DIM, which is a supplement that prevents that aromatization. And if it gets too much, you can take an aromatase inhibitor. So a pharmaceutical grade blockade of testosterone to estrogen. But it is important to have some estrogen.
And you got to keep your body weight low.
Exactly.
Because that's where you'll end up getting man boobs, and that's where you'll end up aromatizing the testosterone into estrogen, is through the fat. If you have a lot of fat.
Exactly. Through the fat.
Okay. Is GAINSWave safe to get with a medium grade prostate present?
Absolutely. It
Okay.
really the size of the
Great.
prostate doesn't have any bearing.
How much does GAINSWave cost? I'm looking at I'm looking over here because we've got our questions up behind the camera. GAINSWave, really so GAINSWave is a process that a practitioner gets trained to do in a very specific way. And so when you're going to a GAINSWave doctor, there's shockwave treatments. There are many different kinds of devices. You might even want to turn that device off.
Sure.
It probably is making noise. That's an eclipse machine that Dr. Brandeis is using, is one of the types. There's stores. There's other types of machines that create Zimmer. There's a lot of different machines that can do shockwave therapy, and there's shockwave therapy. And then there's the GAINSWave branded treatment, which is the one that is, what's the best way to say it? You say it, because you're a GAINSWave clinical director of excellence.
I'm the clinical director of excellence for GAINSWave. And so there's a certain protocols that we recommend that are scientifically based. There's a certain training that all GAINSWave providers undergo. There's a GAINSWave community, so we all gather on certain websites to share ideas and to compare notes on treating patients. And in addition, all the GAINSWave providers, and not all the GAINSWave, but as the director of clinical excellence, I created what's called the SWEET study, or the Shockwave Erectile Enhancement Trial, because there's been a lot of research on GAINSWave and shockwave for erectile dysfunction, but not enough. And there haven't been really large, massive trials. And so I took it upon myself as the director of clinical excellence to initiate a trial. And I called it the Shockwave Erectile Enhancement Trial. And we have 45 GAINSWave providers from around North America. And we're all contributing patients to this database. And my goal is to have thousands of patients in this database. And with those thousands of patients, we can individualize patient protocols, so that if you're a 55-year-old male that's otherwise pretty healthy and having mild erectile dysfunction, we need to treat you totally differently than the 72-year-old with diabetes and smoking and you're on a beta blocker. Those are two totally different protocols, but the current studies haven't really differentiated between those two patient groups. And so what we're trying to do in the SWEET study is to develop a large enough database, thousands and thousands of patients that we follow for years, so that when you go to your GAINSWave provider, you can say, okay, I'm 65, I have some mild heart disease, some early diabetes, and my SHIM score, which is a measure of your erectile dysfunction, is 12. And you'll put all that stuff into the computer, and the SWEET study will kick out a number saying you need 9 GAINSWave treatments and you need a nitric oxide booster, and maybe you'll benefit from a vacuum erection device or PRP. We're going to try to roll all that stuff up into the research to really individualize the patient experience and to help you.
So as far as the cost, you can go to someone who's going to give you a shockwave treatment, and you can go to someone who is a professionally registered GAINSWave provider. And if it were me and I had somebody wielding a shockwave device on my penis, I would be trying to find the GAINSWave doctor because they've had some training. Because really, anybody can buy a device. You know, they cost $20,000, $30,000, $40,000, right? So anybody can buy a device for their practice and say they do shockwave treatments and have absolutely no training and just get in there and hope they're doing it right. But if you have, like I have been lucky enough to not only experience GAINSWave myself on my vulva, but I have also gone with my husband for 2 years in a row because now he likes to get an annual tune-up. And I have watched the treatment getting done. And there is a big difference between someone who is well-trained and is using a high-quality device and someone who's using some home device and, you know, wishing for the best. Now, I do understand that not everybody lives in a place where there's a GAINSWave provider. They're still rolling out in Europe. They're still rolling out in Australia and New Zealand. But there is, if you are in the United States of America, to me, if you can afford it and there's no one in your area, fly someplace to a local trained GAINSWave provider. Because what you're going to end up wanting to do is get a series of treatments, which is what I also think we should talk about is, you know, some men have said, well, you know, I got 6 treatments and it didn't work. I've talked to men who had diabetes, for example, where they had, you know, kind of the double whammy of arterial plaque and diabetic neuropathy. And I had a guy who told me, I just believed it would work. And I kept going and I did a series of 6 treatments. So he did 18 treatments and it reversed his ED. So there are some men for whom one series of 6 treatments won't be enough. But I saw somebody on here saying, what's the price of having a great sex life? I mean, if you can reverse that, what is the price of that? So talk about how most of the GAINSWave providers do the series of 6 and why they do it the way they do it, you know, and how that works. And then let's also, I'll read the rest of these and see if there's any other kind of GAINSWave specific devices or questions. But then I think we should start layering in the PRP conversation.
Right.
Because they go so well together.
So, and the initial research on GAINSWave was based on 6 treatments. And so the initial treatment would be what we call a 6-pack or 6 treatments. And that's 6 treatments over a period of 3 to 6 weeks. But for men who are in their 70s, men with heart disease, men with diabetes, men with other issues, 12 treatments has been shown scientifically to be better than 6 treatments. And there's a recent paper from 2019 from Greece that actually showed initial 12 treatments and then an additional 6 treatments 6 months later boosted it even more. So I think that the key is that what this does is it creates angiogenesis. It creates a stimulus for the growth of new blood vessels. And so the more you get it, the better. Now, does it last forever? No, of course not. If you go to the gym and work out really hard for 6 weeks, does that mean you're going to be in shape for the rest of your life? No, of course not. So one of the things we're going to do in the SWEET study is to follow our men every 3 months for as many years as we have funding for the SWEET study to see what the decay in erectile function is. But at Brandeis MD in San Ramon, California, what we do is we have our men in every 4 months for one single treatment, like a recharge, right? So, you know, you charge up the battery and then over a period of time that battery discharges. But the thing is, you don't want to be at empty. You don't want to have to rejuvenate. You want to prejuvenate.
I love that.
You want to stay in shape. It's like working out, right? Do you want to get to the point where you're fat and totally out of shape? Or do you want to just maintain what you have and sometimes build on what you have? And that's the best way to treat your erectile function is maybe in your 40s, you want to take a nitric oxide booster and even a PD5 inhibitor like Cialis that you can take every day. And then maybe when you're 45 or 50, you can begin to start doing preventative maintenance with GAINSWave to grow. If physical intimacy and erectile function is important to you, then it's important for preventative medicine. The same way that you go to the gym, the same way that you go to the cardiologist, you could go to get GAINSWave.
See, I wouldn't want to take the Cialis every day. I don't know why. I just don't want to do that. I would rather go get the GAINSWave treatments and use the vacuum erection device and take my nitric oxide supplements. But why do you like to drip? Why do you like to drip in the PDE5s?
The
Because
PDE5,
I know you do.
yeah, I mean, it works naturally. It's part of the signaling pathway.
Mm-hmm.
So, okay, just like a 2-minute prime round blood flow.
Yeah.
Okay.
Great.
Your body needs to move blood around from place to place in your body. So, for example, you're exercising, right? You need blood in your arms and your legs and your heart.
Mm-hmm.
Okay. And then after you exercise, you go and eat something,
Yeah.
right? So then your body needs to move that blood to the intestines. And then after you eat something, you go and you start reading a book. Then your body needs to bring the blood up to your brain.
Mm-hmm.
So how does your body do that? Well, there are basically two hormones or two molecules that they use to do that. One is nitric oxide,
Mm-hmm.
and the other is a system of enzymes called the phosphodiesterase enzymes. Okay, so nitric oxide is what your nerves release when nerves are stimulated, and they drip that on blood vessels, and it causes dilation of the blood vessel.
Mm-hmm.
But you have to, from that dilated blood vessel, you have to constrict that blood vessel. Otherwise, that blood vessel is going to remain dilated.
Mm-hmm.
And so you have this system called the phosphodiesterase system, which are enzymes that break down the byproducts of nitric oxide. And so then that closes the blood vessel. So the genius of Viagra was that it blocked a very specific phosphodiesterase enzyme called phosphodiesterase number 5. So if you're reading about Viagra and Cialis and Levitra, and you read something that says PDE5, what that means is that these medications specifically block phosphodiesterase number 5. And so that's the genius of Viagra, is that it keeps the blood vessels only in the penis open, whereas the blood vessels in the rest of your body are more constricted.
How does it know how to keep just the blood vessels in your penis open?
It's just very specific to that PDE5 receptor.
Oh,
so
that
receptors in your
receptor's
body.
in your penis.
Exactly.
Okay, but
It's like, how does your key know to open up a certain door?
uh-huh.
It's just the shape of the inside of the receptor.
And how much PDE5 does a guy take on a daily basis?
So that really depends. And it's interesting if you look at the levels of PDE5 inhibitors in your body. So for instance, Viagra at 1 hour will shoot way up. By 4 hours, it's half out of your system. By 6 hours, it's 3/4 out of your system. By 8 hours, it's all gone, pretty much. Whereas something like Cialis or Tadalafil, at 1 hour, it's at 100%, but 18 hours is at 50%, and 36 hours, it's at 3/4, so 25%, and then by 48 hours, it's all gone.
Mm-hmm.
So what you can do is you can take a lower dose of Cialis, and that remains in your blood system. You're much less likely to have side effects from that. And if you take that with a nitric oxide booster, and I know you have one that just came out called Flow, and we have one called Affirm, and they're very similar. That it's important that your nitric oxide booster, whatever you're taking, has L-citrulline.
Yeah.
Okay, L-citrulline is much more important than L-arginine. L-arginine gets broken down by your liver and turned into basically nothing, whereas L-citrulline, when it gets into your body, is converted into L-arginine in the kidneys, and L-arginine becomes the nitric oxide donor.
Mm-hmm.
So I love that the Flow has nitric oxide boosting L-citrulline.
Yeah. Let's see. Where's mine? Flow. Yep.
Cheers.
So cheers. So here we are. I'm the sexpert and he's the urologist. And what do we both create? We both created a citrulline nitric oxide.
Exactly.
So what else is in yours?
We have Mirapuama, which is a potency wood. We have ginseng, which is a potent nitric oxide booster, and beets. So
nitrates from beets, which is a different pathway.
It's a slightly different pathway, but in the end, it's a nitric oxide booster.
Yeah.
What about yours?
In Flow, what I did was I wanted something that was organic because I'm kind of an organic nut,
well,
as you know. Exactly. So I like things that are made from real foods as well. So I got the citrulline from watermelon. The watermelon Latin name is actually citrullus. So citrulline originally comes from watermelon. So this is organic watermelon, and then organic spinach, which is where the nitrates come from in my particular product, as well as kind of the analogous to your ginseng is something called Pinus pinaster, which is French maritime pine bark. It's a polyphenol, which is also it's like a third dimension to opening up blood flow. And then I put in vitamin C for absorption. So I got that not from ascorbic acid, but from cherries, bitter cherries, and they're organic. And then I have one more thing in there, N-acetylcysteine, because that actually slows down the combustion, if you will, so that you get vasodilation. Basically, both of our products are vasodilators. And so you take this every day because as you age, your ability to produce nitric oxide, that combustion in your body doesn't work as well anymore, just like everything else. And so if you want good blood flow for erectile function, take whichever one or both of these products you like. I also really like to take it I recommend taking it before pumping using a vacuum erection device. So you want to take a little bit every day. I don't like these powders that the bodybuilders take where they're taking like 4, 5, 6 grams of these arginine and citrulline products. It's too much. It's too much for the older man.
Well, you get expensive urine.
You do get expensive urine.
But I think
too hard on your body.
Important thing is that we're not here to like hawk our supplements. I think there are a lot of supplements out there that don't have a lot of scientific basis to them.
And they're very low quality.
And they're low quality.
Low quality ingredients made in a vat in China full of corn syrup that comes from pesticide-laden corn. That's what I don't like.
But there's real science behind nitric oxide boosting. When I was at UCLA, one of my professors won the Nobel Prize for discovering nitric oxide as a second messenger. Another one of my professors discovered the mechanism of action of Viagra. And it's very well established that boosting nitric oxide improves circulation, improves brain circulation. So it reduces Alzheimer's, it reduces dementia, it improves athletic performance. Elite athletes will improve their performance 2 to 3% on these nitric oxide boosters. It improves erectile function, and anything that requires circulation in the body will be improved by boosting nitric oxide. Now, something like Affirm, each tablet in Affirm is equivalent of 1 pound of watermelon. So you can either eat 4 pounds of watermelon,
which is too much sugar,
on a daily basis, or you can take something like Flow or Affirm to boost your nitric oxide. But it's critically important. Once you get to about 40 or 45 years old, your nitric oxide levels begin to wane. And it's one of those very simple things that's preventative, that's prejuvenation, as opposed to going down and then needing to rejuvenate.
Remember as well that your wife, girlfriend, partner should be taking a nitric oxide booster too. Remember that in our genitals, in our female genitals, we have as much erectile tissue as you do in your penis. And it's important for us to have blood flow to our clitoral structure, our urethral sponge, our perineal sponge, to the labial area, because number one, we'll have more intensity of orgasm. Number two, we'll just overall have more pleasure and sensation. We'll have more tumescence, which is engorgement. And engorgement, you want the vulva to be plumpy and fluffed up. Her vulva is flaccid until she gets enough stimulation and blood flow. And so as she ages, she loses blood flow the same as you do. So that's why it doesn't really matter whether you want to take Affirm or you want to take Flow, or I wouldn't take another product, I would take ours, but whatever you take, start taking some nitric oxide supplementation for both of you. I made this for couples to share because it's really important to do both. Now, there's 2 other quick questions on GAINSWave. One is some questions about FDA, is it an FDA cleared device? And number 2, they're talking about these class 1 versus class 2 devices. And then someone else asked about GAINSWave versus Boston Medical Group. So can you answer some of the those more technical questions about GAINSWave?
I saw Bill ask that question. It's a really good question.
Yeah.
So class 1 versus class 2 basically depends on what clearance the device has gotten. So it's more of a technical issue. And then the question of, is focused wave better, or radial wave better, or pressure wave, or acoustic wave, or rejuvenate, or GAINSWave? All these technologies use an intense energy waveform to stimulate inflammation, which stimulates an inflammatory and a healing response that develops or grows new blood vessels. Okay, you can call it whatever wave you want. The issue with GAINSWave is that people are trained, you know that people are trained to a certain level if they're GAINSWave providers, and that they participate in continuing education and continual training. We make training videos, and we're constantly educating and re-educating and keeping the GAINSWave providers up on the most recent data and the most recent protocols and the how to treat patients the best. I don't know, I can't vouch for anyone other than GAINSWave providers because I don't know what they're doing.
Yeah.
But this is an FDA cleared device. So devices are cleared, drugs are approved. This is an FDA cleared device. It's not an FDA cleared indication, but the FDA cleared indication is temporary increase in blood flow. And what you're doing basically with GAINSWave is temporarily or permanently increasing blood flow. So technically it's not FDA cleared for this indication, but in reality it really is. The other part of it is that I've treated hundreds and hundreds, probably 500, almost 1,000 men at this point.
Yeah.
Knock on wood, there's not one single complication, not one single patient has been injured or any way, not even bruising. In fact, it's if you're on Plavix or aspirin or some of the other blood thinners, it's safe. It's been shown to be safe in studies. So it's extremely safe. And there are some patients that are texting in saying that I've had 6 treatments, it didn't work for me. The only downside really is time and money. It's not like something bad's going to happen.
Yeah. And it might be that you need more than the first 6 treatments.
Right.
Right.
Yeah, I mean,
you might have to have 2,
there
and
are
you
many-
might have to have 3, but you can stagger them over time.
Exactly.
And you can call around and you can get quotes from all of the GAINSWave providers in your area. So you can decide whose office do you like? What doctor do you prefer? What's their price point? Do they offer any kind of, you probably offer some kind of like, payment program through, there's usually a third party that will let you pay things off, care credit and things like that, which is really good. But what I always tell the people who ask me is, obviously, if you can get a GAINSWave practitioner, it's best to go with them. Now, Mayo Clinic, they're going to be just as good. I wouldn't see why, if you have access to the Mayo Clinic, that you wouldn't want to go to somebody like that.
And the interesting thing is, there are a number of questions up there saying, well, what happens if it doesn't work?
Right.
Okay. And this is a great, great question.
Mm-hmm.
Okay. If it doesn't work, there's either a problem with blood flow or with the nerves.
Yeah.
Okay. Usually the nerves are a little bit more obvious. They either have type 1 diabetes, or they have a history of prostate surgery or stroke or multiple sclerosis. The blood flow issue is a little trickier. Okay, so in my clinic, what we do is if someone, so I basically assess the patient and I say, okay, I think this patient needs 6 treatments. I think this needs 12 treatments. If after 12 treatments they haven't benefited, then what I'll do is I'll send them for a vascular study, meaning that I'll send them over to one of my colleagues who's a vascular surgeon, and they'll do an ultrasound and they'll look at the blood vessels in the aorta, in the iliacs, and in the internal iliacs, specifically looking at the blood flow to the penis.
It's an upstream it would be an upstream problem at that point.
Exactly.
So the worst thing you're going to do is find out that you have an upstream problem that you need to take care of.
Exactly. And I've picked up patients who've had aneurysms, patients who've had severely blocked blood vessels that the vascular surgeons need to operate on. So this is what I'm talking about. The penis is kind of the canary in the coal mine. If the canary doesn't come back out, you got to go figure out what plan B is. And plan B is make sure that you get a vascular study. Okay. Another thing that you can do is use a vacuum erection device.
Yes. I want to talk about those. Yeah. Let's wait on that though, because I want to move to PRP before we go to the vacuum erection devices.
So a PRP is another tool in the toolbox. And this is one of those things that they work synergistically. So we talk about triple therapy, which is a nitric oxide booster, a PDE5 inhibitor, and GAINSWave. And then you can add PRP. So that's quadruple therapy. You add a vacuum device, it's quintuple therapy. So what PRP is using platelets, which are loaded with growth factors, to stimulate the growth of new tissue. So if you're out walking one day and you trip over something and you cut your arm, what happens? There are 4 phases of an injury. The first phase is what we call coagulation or hemostasis. It's mediated by platelets. Platelets go to the wound. they get activated by calcium and they open up their arms and they grab onto other platelets and they form a clot. The second thing that happens is called inflammation. So the white blood cells go to the area of injury, they gobble up the bacteria, they remove some of the devitalized tissue, and then they go away. The third phase is called proliferation. Proliferation is where new cells grow to close the gap. And then the final phase is called remodeling, so that we're all not scarred up from when we were little kids. Okay, what drives this process is actually the platelets. Okay, when platelets are there, they open up and they release these things called alpha granules, and these alpha granules are loaded with growth factors. Okay, that's why when you cut yourself, you heal the area of the cut, but the rest of the skin doesn't change. And so what you can do is you can draw blood, although sometimes I'm not so great at drawing blood. That's an inside joke. But you draw blood, you spin the blood. When the blood spins, the red blood cells, which are packed with iron, go to the bottom. The plasma, which is basically water that your blood floats in, goes to the top. And then you can take out that middle layer, which are basically platelets. And then you can use that to inject in a number of different places. So it's huge in orthopedics for partial tears to accelerate the healing process. You can use it, like I used it for hair growth. Now, it doesn't look like I had a lot of hair, but believe me, this is about 30 or 40% more than I used to have. And you can use it in the penis. And so if you inject PRP into the penis, oh, thanks.
It's really coming in. That's amazing.
Yeah. This was another situation where I was like, this, couldn't work.
It works.
And so I'm my own guinea pig. I experimented on myself, and believe it or not, it actually worked.
Yeah, I just had PRP, and I also had Tim do it, PRP in the head. I also had a PRP face and neck lift. So essentially what they do is they can take the PRP, and because it coagulates, it thickens, they wait a minute, they put it in a needle, and then they'll inject it into the nasolabial folds, into the cheeks to puff them up a little. We get a little thin here as women as we age. They put a little in here and plump up your face with injections into the lips. And then they'll coat your face and punch it with micro needles into the skin's surface to essentially put all that PRP into the epidermal layers so that it brings more collagenation and new growth to that skin. So it both plumps different areas of your face when you inject it directly into areas, as well as making all the skin texture and tone nice. So you can regrow your hair. I also have it in this thumb. I hurt my thumb getting my scuba diving certification, and I was screwing those tanks, and somehow I tore something in my thumb. Very common for women. We have less hand strength. So women get a lot of joint pain in our hands. So PRP right into these joints. PRP, you can get your shoulders, your knees. You can put it, literally punch it topically into your skin. It is the miracle of your own body. And when you inject it into the penis, it brings all those growth factors to that tissue. So what I love is the combination of GAINSWave stimulating that, like knocking off the plaque, stimulating new nerve and tissue growth, not only in the exposed penis, but the buried shaft. They get down in there, up in there, into that shaft, and get that whole thing really growing new tissue. And then you inject the PRP, and it's like a turbo booster. You're then recruiting all the stem cells and all those healing factors you've done the damage, and now you're adding in this wonderful golden broth that it accelerates repair and new tissue growth. And then you add the third piece on, which is the vacuum erection devices. So let's talk about those.
Well, Dan has a question.
What is it? Where's Dan?
Will
P-shot increase penis size?
And so, at Brandeis MD, we're actually committed to research. We have the shockwave study, the SWEET study.
Yeah.
We also have the SWAP study, which is the shockwave and Peyronie's disease study. And I saw a question about Xiaflex, and I'll get to that in a minute.
Good.
But I also have the P-long study, okay? Because guys want longer penises. So when they survey men, 55% of men want longer penises.
Only 55?
Only 55.
I can't imagine that. Is there any guy on here who doesn't want a bigger penis? I mean, everybody. very few guys
You know,
don't want a bigger penis.
The issue is that there are some guys that actually do something about that.
Yeah,
Okay?
lots of them.
Lots of them. And sometimes those things don't work out so well. For example, men go and get the suspensory ligament cut. So the suspensory ligament is the ligament right here that holds the penis up, and it allows the penis to get an erection that goes up. And if you cut that suspensory ligament,
you get a
the
drop.
penis will drop down lower. So it looks longer in the shower, but it doesn't really actually get longer. And so if someone wants to cut your suspensory ligament, run away. But the problem is thousands of men have had their suspensory ligaments cut, and that's really a dangerous situation. The other thing is some men get fillers or fat or other substances, silicone injected subcutaneously into the penis. So injected here, and in the wrong hands, that also is really dangerous. And so in some respects, it sounds a little trivial that we're doing an IRB approved clinical research study on penile elongation. But, you know, the sad thing is that some people really have operations or procedures that cause a lot of damage to the penis. And so to me, that was really sad. And so I wanted to do something about it. And so I'm working with Dr. Runnels, who trademarked the P-Shot, and I'm working with Eclipse to provide PRP kits, and I'm working with Jasiva Medical, who's providing the vacuum erection devices, and I'm working with Pathright Medical to who's I think has the best penile traction device. And I developed a protocol.
Bring that back. Yeah, explain how this works. Show what this does. And this
Sure.
is, you're using this more for men with Peyronies than you are
Both
for
with, there's outstanding
enlargement?
data with for penile enlargement and also for Peyronie's disease. And so what you do is you adjust the length, and you open it up, and then let's see. You would attach this across here. Now this is a rigid model, and then you activate the spring, and this results in penile traction.
So it's a stretching
So
device.
it maintains continuous stretch. And if you put this on for 15 or 30 minutes, the data on Peyronie's disease says that it'll grow your penis by about 2 centimeters, which is almost an inch.
Yeah.
And so
very uncomfortable.
Yeah.
But for some men, that is absolutely the right.
It's actually not nearly as uncomfortable as you think it might be.
Now, what we don't want you to do is go buy something like this from the adult store or from Amazon. These are, there's no gauge, so you can't tell what vacuum pressure you're using. This is, who knows who's going to fit into a tube like this. It could fit you perfectly. For most men, it's probably not the right size. The release valve is very tight and difficult to use. You want a really nice, easy release valve. Do you want to get your
if you have something like this, you can blow up your pool rafts with it.
But you don't want to use it on
you
your
don't
penis.
you don't want to use this on your penis.
And you and I, we like different pumps, and that's totally fine too. Go ahead and talk about yours.
Well, so this pump is battery operated, and so you basically push one button to inflate, and you push the red button to deflate.
And how do you tell what the vacuum is? How do you know what vacuum you're going for?
There's a gauge inside that prevents it from getting overinflated.
I see. Okay.
And so you don't really need a number gauge. There's a valve that stops it when it's getting overpressurized.
Gotcha. Okay.
But men will tell you, you can tell when your penis is beginning to get stretched, and you can tell when it's beginning to get overstretched.
Yeah, but guys, they'll just do it until they'll be like, I can take it. I can take it. I'll just go to level 11. Exactly. This is testosterone. You guys are so bad about that.
This is Spinal Tap. Turn it up to 11.
Yep. Well, I just want to show you an alternative, and this is one that I've had a lot of success with. So this one is the product that I really like. It's called the Whopper. And no matter what, listen, penis pumps really work. I have over 1,500 men this year. Over 1,500 men are pumping now because of my advice. and they're tracking their gains and they're doing really well. And so I really wanted to be a person who stood for men's erectile function. And I really love GAINSWave. I think the PRP is amazing. And I think penis pumps are an every other day, really great thing that you can do that will enlarge your penis. It will reverse atrophy. It will increase blood carrying capacity. It does all of the things that you want to do. And
let me, from a scientific perspective.
Yeah, go
First
ahead.
of all, I want to thank the 374 people that are still hanging with
Yeah.
us at an hour and a half. And we're still raring to go. There's
Yeah,
a lot of still
we got a
good
lot to cover.
information.
Yeah.
And I'm going to get to that Xiaflex question in a second. But
Good.
The reason that penile pumps work is because as you get older, you don't get as many erections at night. And erections at night are really critical. So erections at night do a couple of things. One, they stretch that tunica albuginea, that really rigid tissue. And the second thing they do is they bring blood flow into the penis, because the penile spongy tissue on the inside is going to get fibrotic if it doesn't get oxygenated blood. And at night, when you're younger, you get 3 to 6 erections that last 30 to 60 minutes in total. And if you don't get that when you get older, your penis doesn't stretch as much. If it doesn't stretch that much, one, it gets shorter. Two, it takes more blood pressure to pull that penis out. And if you're not getting enough blood pressure to begin with to do that, it's just going to get worse. And then the third thing is, think about a sponge. If you go and wash your car and leave the sponge out overnight, it'll compress. And the reason that sponges work is they have space in them. So when you're trying to get an erection and blood is going into a sponge that's compressed, it takes more and more blood pressure to open up that spongy tissue. And so you need more blood pressure to get a rigid erection. An easy way to do that, if you're not getting nighttime erections, is to use the vacuum erection device once or twice a day to get a good stretch, to get good blood flow, a good oxygenated blood flow into your penis. And you'll be able to maintain prejuvenation, not rejuvenation, but prejuvenation. You'll be able to maintain erectile function into your 60s, 70s, 80s, even 90s in some cases.
I'd like to add a few things to that. Thank you for that. One thing is that while you're getting your GAINSWave treatments and you're if you're trying to do things like reverse Peyronie's scar tissue problem, then pumping every day is a good idea. But otherwise, pumping every other day is the best recommendation, because it's just like going to work out. You don't work your muscle out every day, and you don't even work out the same muscle every other day. You work it out, you do your sets, right? It's just like pumping your bis and tris, and then the next day you're going to do your squats. It's important to go every other day so you get rest and recovery time. The second thing is that it's really important to get the right fitting pump. So you've got to get one that really fits well on your particular penis. And men have quite a variety of penis sizes. So you want to have a system where you can not only, start with a small cylinder, but once you outgrow it, you can go to the next size up. So having a system that you can exchange the cylinders. And then the reason that I like this particular system, and Tim, if you want to post, or Adrian, if you want to post the links to the pump that I recommend, and that's to trustyclick.com/pumpswork, or to Gesiva, GESIVA.com. You can check both those pumps out. This is the reason it's called the Whopper, is this your testicles and your penis actually go inside here. So first you pump with the small tube, and then with just your penis, flaccid, pull the blood in, hold the blood in for 10 minutes, then release the vacuum, and then masturbate yourself to an erection if you can gain erection, and then go flaccid again, and then put your testicles and your penis in this one, and then pump up for 10 more minutes, holding at, when you start, only a -2 to -4 pressure, and then maybe at the most you'll go up over about 12 or 13 weeks is to a -5, -7. Wouldn't even recommend you going all the way up to a 10. You want to really go low and slow. There's this funny little saying, the hurrier I go, the behinder I get. Like, trying to go faster actually can work less well. You want to slowly, over time, bring that blood and get those blood vessels pumping more blood and growing. And when you put this one on, the Whopper tube, what it's doing is pulling on that suspensory ligament, and the suspensory ligament. So almost all pumps will give you girth. And if you just want to get girthier, just a regular pump, like the Gashiva is good. But if you want length and girth, if you're really doing it for enlargement specifically and not just for blood flow, then you want to use something like this, because you're going to get a draw on that ligament that is going to allow you to get the length as well as the girth. And then when you pump, you also might need something like a head enlarger, because what happens when you pump is you get the most blood at the base of the penis. And so you're going to see that at first, when you're pumping, the base of your penis is getting a lot bigger. That's the first thing you'll notice. And then slowly over time, you'll get girthier and girthier. But because the blood goes to the end last, you might say, oh no, now I kind of have this like wedgie look where I want to have my head bigger. I want to make the glands bigger. And so there's actually something called a head enlarger that you can add on as well. And so that's one of the things that I really like about these kind of more, it's a modular system. It's not as easy as one pump on your penis. So it's up to you. Some people are like, I want to do all those things. Other people are like, just give me the simple one. Totally get that. But in this way, you just attach what you need, and you can do a hand pump or an electric pump. So 13 weeks till you really see results. You will see results. They say about 20% enlargement on average for guys. And I love that it reverses atrophy, gives you more blood flow. It's good for you. It's self-care. This isn't weird. There's nothing wrong with it. It's really taking good care of yourself. So I want you to feel confident that whatever quality pump you choose, whether it's the one I recommend or the one that Judd recommends, that I want you to feel like there's absolutely nothing wrong. This is a medical device that is good for your health. So there you go. I'm very passionate about these things, aren't I, Judd?
Oh yeah, absolutely.
I got to take care of my guys. They trust in me to put them in the right way. I also have a bunch of.
There was a question about Xiaflex.
Yeah, let's answer that, and then I do want to also. I have a couple of show and tell sex toys that I thought might be fun at the end too. Absolutely. Did you show everything over there on your little?
Pretty much. Yeah.
You did good. Well, pre-long. I want to talk about premature ejaculation and delayed ejaculation and semen volume, and also some interesting male sex toys for those of you who can hang on with us. But go ahead, Xiaflex. You go. Yeah, so
Xiaflex. So for Peyronie's disease, really there are only 3 approved treatments. Okay, one is surgery. The advantage of surgery is that it makes the penis straighter. The disadvantage of surgery is that it makes the penis shorter, and a lot of times it desensitizes the penis. It depends on the technique that you use to do surgery on, and it's expensive, and it puts you out of commission for a long period of time. Okay. The second option is something called Xiaflex. Xiaflex is what's called a collagenase. It's an enzyme that dissolves collagen. Okay. The advantage of Xiaflex is that in studies, in FDA approved studies, it's been shown to reduce curvature about 15 or 20%. Okay. That doesn't seem like a lot, but it's better than nothing. And it can be the difference between not being able to have intercourse and being able to have intercourse. Okay. Another option is GAINSWave shockwave therapy. Okay. What that does is it breaks up the collagen. But getting back to Xiaflex, the disadvantages of Xiaflex is that, one, it's dreadfully expensive. So the medication cost is $3,000 to $4,000 per injection. Most patients need between 4 and 10 injections. So that's about $15,000 to $30,000 or $40,000 of medication cost. The second thing is that you have to actually inject it directly into the plaque, which is not comfortable. And the third thing is, because it weakens the collagen, you're not allowed to have intercourse for about a month because you're risking a penile fracture. And so it's for some people. And especially if something like GAINSWave doesn't work, because it doesn't work on everyone, but it's a low bar to jump, because the costs of surgery and Xiaflex are pretty dreadful, and it's going to keep you away from having intercourse for months. Whereas something like GAINSWave, if it works, and it does work in a percentage of men, one, it's much less expensive than the other options. And second of all, we actually encourage you to have erections because it's part of the stretching process for the connective tissue. So my algorithm for most of my patients is try GAINSWave first. If GAINSWave doesn't work, then you can try XIAFLEX, or even what I call sandwich therapy, which is trading off between XIAFLEX and GAINSWave therapy, because I found that that works for a lot of patients as well with more significant curvatures.
I was looking at some of the other comments too. The gelking. I don't think gelking is a good idea. I have gotten so many emails from guys that have tried gelking and hurt themselves, that if you're gelking, I just think a penis pump, a vacuum erection device, is a much safer way to go about any kind of enlargement construct. So
basically, when they're gelking, they're pulling the penis down and they're stretching this suspensory ligament.
Yes,
so you're
exactly.
actually you're not increasing the length of the penis, although this part of the penis is attached to the bone.
Mm-hmm.
But mostly what you're doing is pulling that suspensory ligament. So maybe you're pulling your penis out a little bit more, so it hangs lower. But the erect length of the penis after that, I haven't seen any evidence or good
I've
data.
seen no good come of gelking. And that's why I like the Whopper, because at least you can tug on the ligament safely because you've got a readout and you know what you're doing. I really like that. And that's the other reason someone said I got a bathmate. I don't like the bathmate. I think the problem with the bathmate is there's no readout. You don't know what you're doing. You don't know how much you're pumping. And guys over pump. You guys always over pump. And so, you're trying to get maximum gains in the shortest amount of time. One thing that you can do, one of the things I like about the bathmate is that you can do it with warm water. So what I recommend is that you wrap your penis in a warm, wet washcloth before pumping. And then you can use that same washcloth for cleanup, which is really nice. So that gets the benefit, I think, of the bathmate without the negative, which is the lack of a readout. The other issue is that both of the pumps that Judd and I recommend, people will actually answer the phone when you call the company. Not only answer the phone, but I know from my perspective, they're so on top of things. They get right back to people. They help them for day after day after day with questions if they're having trouble getting started. They're right there to support people. That's the same way with GAINSWave doctors. They're going to be there because they've made a commitment to supporting you. There's a lot of alternative stuff out there that you just have to be careful for. Everybody's in the business of doing these things these days. They get an Eclipse machine and they're like, all right, I'm ready to go. I'm going to shockwave some penises. And you have to be careful because you're a delicate instrument. Your body is delicate, right? So be careful with that. Someone asked, who administers the treatments, man or woman? It really depends on the doctor's office and who you go to. So that's a question that you can ask when you call to talk to someone, which you can do. Let's see.
What are the number of pulses
applied? Yeah.
So in a round number, around 10,000. And so that takes about 15 to 20 minutes or so to administer that number of pulses to the penis.
Yep. What are the thoughts on RestoreX for PD treatment along with pump?
I think
what is RestoreX?
So RestoreX is this penile traction device.
Oh, that's what that is. So, okay.
If you look at the penis under the microscope.
What's a PD treatment though?
Peyronie's disease.
Oh, for Peyronie. Yeah. Okay, good. Got it. So okay, I'm with you now.
There's collagen that runs in two different directions. It runs longitudinally along the length of the penis, and it runs circularly. And so the penile traction devices are great for increasing the length of the penis or pulling stretch in that direction. And the penile suction devices, like the pumps, are good for girth. Right. So because the thing is, if you just use the RestoreX, you're going to end up with a pencil penis.
You don't want to be a pencil.
Yeah, you don't want to be a pencil. Because according to polls, women prefer girth, and men are more wrapped up in length.
And well, it's interesting that the vaginal opening, which is called the introital sphincter, has something called mechanoreceptors in it that actually respond to pressure. So that's why a girthy penis feels good inside her. Also, for a lot of women, they don't necessarily like to have their cervix hit by the penis during sex. That can be painful for women. And that's another reason why women prefer, if they had to choose, girth over length.
Now, what about the length of a sexual encounter?
Well, I think that really depends on the woman. There's certainly it takes time for women to achieve climax, and there's a lot of interdependencies. One of them being how engorged you got her vulva before penetration. What's her level of natural lubrication or added lubrication? Just generally, where might she be in her cycle? And even postmenopausal, women are at different places in their cycle. Women still cycle even if we don't menstruate. So we still go through those kind of highs and lows, you know, what we do. So tumescence, the blood flow for her, how much she's got, how much lubrication, and then how easy is it for her generally to climax from intercourse, you know, having a penetration orgasm. And then it just depends every time. Sometimes she wants to go longer. Often women want men to last longer than they can. That's a common thing. About 1 in 3 men suffer from what they would consider to be premature ejaculation, or they simply just want to have more stamina. They want to be able to last longer. It's interesting that erectile dysfunction gets kind of all of the
big news.
The news because there's a pill for it, right? But the thing is that erectile dysfunction is actually a smaller issue than premature ejaculation. Most men want to last longer. They call that the orgasm gap, bridging the orgasm gap, the time between how fast a man can climax from penetration versus a woman. She's much slower at achieving her orgasm or multiple orgasms from intercourse. So being able to last longer is beneficial. And Judd has a supplement that I'm very excited about called Prelong that I'd like him to tell you about, because one of the issues for guys is that some men are naturally just more sensitive, but equally as much, you can learn how to understand where your point of no return is, where you're going to go over the edge into climax, and learn how to manage your arousal levels to pull back from that. So there's an awareness that can come. But anytime you're worried about coming too fast, you've got performance anxiety, and that actually hastens your ejaculation. And so a big part of getting over premature ejaculation is dealing with the anxiety of it. So that's what I really love about what you've created.
So in terms of premature ejaculation, there are really 2 current treatments. One are delay creams like Promescent, which numb up the penis.
Yeah.
Now the problem is, if you're numbing up the penis, you don't enjoy the sensation as much as you potentially could. And something like Promescent actually is engineered to stick to the male penis, but there are other delay creams that actually transfer to the female partner and make her experience not quite what it could be.
If you're going to use a delay gel, use Promescent, because they have something called an subcutaneous aqueous technology that penetrates below your skin so that you don't transfer it to your woman.
Exactly. On the flip side of that are selective serotonin reuptake inhibitors. So these are antidepressant medications. And what they found was that when people started taking antidepressants, sometimes they couldn't even orgasm, or it would be severely delayed, or sometimes mildly delayed. But what we understand now is that the process of climax involves a brain hormone called serotonin. Now there's another way to boost serotonin levels, which is an herbal way called St. John's wort, and it uses a different channel to block the reuptake of serotonin. And so I created what's called Prelong. Prelong is a combination of L-citrulline and St. John's wort, but a specific extract from St. John's wort that selectively inhibits the reuptake of serotonin, increasing the serotonin levels in the brain, and that improves ejaculatory time. So it allows you to last longer. Now, you're not going to go from 1 minute to 15 minutes, but you may go from 1 minute to 4 minutes, or 1 minute to 5 minutes. And so in combination, it depends on how long you want to last and how bad your premature ejaculation is. But say you ejaculate in 30 seconds or 1 minute. You may want to use something like Promestin to go from 1 minute to 3 minutes or 1 minute to 4 minutes. And then you add something like Affirm to add another 2, 3, 4, 5 minutes onto that. So then you go from 1 minute to 7 or 8 minutes, and you're trying to close the orgasm gap. So the orgasm gap, most men will climax in about 5 or 6 minutes. Most women will climax on average in about 17 minutes. So you have to close that 10 or 12 minutes of gap.
Yeah. Another thing that I also teach is a technique, a body-based technique called the me breath. And that can work well. Like everything, have you noticed how Judd and I are stacking different technologies and treatments and supplements for particular issues? So using these things in combination is really helpful. And the me breath is a body-based technique that uses 3 different pathways in your body. It uses your breath to circulate the energy out of that urge to ejaculate at the end of your penis and up back into your body. The second thing that it does is it uses your pubococcygeus muscle, which is essentially the closing off the flow of the semen. As the semen drops down and wants to come out, you can keep it from dropping down. And then there's a pelvic relaxation technique called the thrust. It's a squeeze, a breathe, and a thrust. And the pelvic relaxation is that most men, when you're having intercourse, your hips are kind of locked, and you're doing this, right? You're doing this piston type thing. But when you start to be able to flex your hips and drop them with some fluidity, that will relax your pelvis. And when you learn how to breathe as well as thrust and do that muscle squeeze, it's kind of like a golf swing. You've got to take each thing, or like driving a car, you got to learn how to do the steering wheel, look in the rearview mirror, look ahead, but you can learn how to do this technique. And when you do that in combination with taking something like Prelong, so you've got the St. John's wort, because anything that's a botanical is going to take you drip it in. It's the kind of thing where it's not like a Viagra that you pop it and then in half an hour you got a boner if you're lucky. It's the kind of thing that you take every day. You're supplementing with that St. John's wort and the citrulline to keep the blood flowing. And that combination of things is really good. So, having all of these tools in your arsenal is a really good way to learn how to get to what I like to call ejaculatory choice, where you get to come when you want to or when she's begging you to. That's a good combo. I saw, did you hold that up? Like, hold it up. And that's at affirmscience.com?
Affirmscience.com.
There you go, at affirmscience.com. So Prelong, really, really great product. The next thing is 74-year-old. His erection is not a problem, but he can't sustain the erection. That's an easy one. Just boom, answer that one.
Sustaining an erection, a nitric oxide booster, maybe a PD5 inhibitor, and absolutely GAINSWave.
GAINSWave.
The thing is, GAINSWave will turn the clock back for 5 or 10 years. So taking a PD5 inhibitor or a nitric oxide booster is going to help when it's in your system, but when it's not in your system, it's not going to help you. Whereas with GAINSWave, you're growing new blood vessels. And by growing new blood vessels, you're going to be able to sustain an erection for many, many years beyond where you would have if you hadn't had that.
John says, I'm 68 and I have good erections sometimes. Will GAINSWave help with making the erections harder?
Harder and more consistent. Absolutely.
Yep. Great. Joseph says, my question is, I had 6 treatments and it didn't work for me. Why didn't it work? And what did the treatment do for me?
Absolutely. Well, the thing is, it's a question of what your health history is.
Yeah.
Are your nerves intact? Are there any psychogenic issues? Are there any hormonal issues? And then if one of my patients had 6 treatments and it didn't work, I usually treat them 2-3 more times. If they don't have success with 2-3 more times, then I send them over to the vascular lab and get them treated, evaluated at the vascular lab to look at what the blood flow is in the aorta and the iliacs and the internal iliac. Because the thing is, GAINSWave works on the internal pudendal artery and the penile artery, but it doesn't work on the hypogastric arteries and the common iliac and the aorta. If there's blockages up there, there's really not much you can do other than go to a vascular surgeon and have a vascular surgeon work on fixing those problems.
Don is 78 and he has type 2 diabetes. What would you say would be the percentage of possibility for success for him with GAINSWave, and how many treatments might he have to take?
Absolutely. So 68-year-old with type 2 diabetes.
78.
78. With type 2 diabetes, it depends on how long you've had diabetes. It depends on how long your blood sugars have been out of control. There are diabetics that have their hemoglobin A1Cs that are well controlled, and there are diabetics where their diabetes is way out of control. But I think it's worth giving it a shot. 12 treatments, someone like that certainly is going to need a vacuum erection device.
Yep.
It certainly is going to need maybe daily dose Cialis. It's going to need a nitric oxide booster like Flow or Affirm. And you may also benefit from PRP. So it depends on how important this is to you and what your financial resources are, how far you want to go. But for the most part, for someone with reasonable financial resources, if this is an important part of your life, they don't make hearses with luggage racks. You can't take it with you, and you might as well go out with a bang.
Jim says, my PSV is 11.82 and 25.4. Would PRP be a better option?
PRP only really,
What's
in my
PSV?
experience, the post-systolic velocity. So it's a
okay.
measurement of blood pressure in the penis.
Okay. So what
And
is
that's-
11.82? Is that
Yeah,
good or
I mean,
bad?
that's on the lower side. Usually we like to have at least 25.
Okay.
But if you grow and develop new blood vessels, your blood pressures in the penis are going to increase.
Great. That's so good. Stephen says, I had prostate cancer 20 years ago. I was immediately impotent and medications never worked. The vacuum was uncomfortable and 12 weeks of GAINSWave didn't improve the condition. Other than prostate cancer, health is excellent. I'm 68 and take no medication.
Yeah. So in that situation, this is what you need.
Okay.
So this is a
great.
penile implant, and it looks like a lot, but in the end, it's all internal.
Mm-hmm.
So this goes on the inside of the penis. This goes on the inside of the abdomen next to the bladder.
Hold it way up. There you go.
And this goes in the scrotum. And by pumping the pump, you're able to create a rigid erection. That erection lasts for as long as you want it to last. There's
So awesome.
no premature ejaculation with implants.
Oh, right. We got to do a delayed ejaculation. I've got one more question, then we're going to
And
do
then
DE.
to get rid of the erection, you just push this pump, and it slowly will resolve. And for men, that should have been offered to you. I hope it was offered to you 20 years ago. Because you would have enjoyed it for 20 years. These things last anywhere between 10 and 20 years.
Great. Can a man with atrial fibrillation take ED medications?
As long as the rest of the heart is okay. If the atrial fibrillation is the only problem, absolutely.
What is atrial fibrillation?
So there are two parts of the heart. There's the atrium, and then there's the ventricles. The ventricles are the pumps that pump blood throughout the body or up to the lungs, and the atrium are the storage chambers that then pump blood down to the ventricles. And so there's electrical signals from the atrium to the ventricle that coordinate that pumping motion. And so the fibrillation means that the electrical signals are messed up and the atrium just kind of fibrillates or vibrates.
Oh, wow.
And it makes it much less efficient in terms of getting more blood into the ventricle.
You guys, please post in the chat how awesome Judd is. Isn't he amazing? We're still answering questions. We're going to get into delayed ejaculation and all kinds of things. But just take a minute and thank him, because we started out with 349 guys on this event, and there's still 300 of you on here. So first of all, thanks for staying on. Second of all, how awesome is Judd? And thanks to GAINSWave. And just, can we get a hell's yeah in the chat room? He's working hard here for you.
Keeping me honest, because Susan is so much more entertaining than I am.
Not really.
No one would want to watch me for 2 hours.
I do, and I always learn so much from you. I love doing these. I've had no success with pumps, ointments, injections, etc. What else is there?
The implant.
The implant.
The satisfaction of men with a penis implant is the highest of any treatment.
Wow, cool.
There's, once it's a surgery, it's a painful surgery. It takes about 6 weeks to get to the point where you can actually use it. But once it's in and once it's working, it has a very, very high level of satisfaction.
Everybody's saying knowledge is power. Thanks. Great job. Judd, thank you so much. Thank you for the info.
Thanks for tuning in.
See? Oh, yeah. Okay, here's another one. I have a badly scarred urethra from radiation for prostate cancer, which is gone, but the urine can no longer pass through the urethra, and a suprapubic catheter is used to pass urine to a leg bag. Will GAINSWave and your stack of concepts work for me?
You know, that's a really good question. So radiation causes scar tissue and stenosis of small blood vessels. And it sounds like
What's stenosis mean again?
Stenosis is narrowing.
A narrowing.
Right? So it's going
you said that
from
earlier, yeah.
this to that.
Okay.
Oops, from that. Sorry. From my perspective, it's going from that to that, but other people's perspective, it's going from that to that. So it depends on the dose of radiation, which is measured in centigrade. And so it sounds like you had a very high dose of radiation, maybe 75 to 100 centigrade, that caused a lot of scar tissue in the urethra. And that's one of the problems or issues with radiation therapy. But also it probably caused stenosis or problems or scar tissue of the nerves. So what I would say is if you have absolutely no erectile function, then there's not a whole lot of hope. But if you have some erectile function, then actually it would be a great option. Great. And I would combine that with a pump. I would combine it with a nitric oxide booster and a PD-5 inhibitor.
Tim, is there a way to pin the URLs for the nitric oxide boosters on the chat window? Can you do that? Okay, so we're going to pin them, and I'll also reply to, well, I'll ask the GAINSWave team to reply with the links, but you can go to the20.store. So it's not .com, it's .store, the20, THE20.store for flow. And you can go to Affirm Science, AFFIRM science.com for Affirm and Prelong. All right.
A couple more questions. First of all, I want to say hello to Dominic. Thank you for tuning in. I invited all my patients to participate. Cryosurgery left me impotent. Okay, the problem with cryosurgery is freezing prostate cancer. Some people use it as a primary treatment, but usually it's used as an adjunct to treatment after radiation. So if you have a recurrence of PSA after radiation treatment, if you haven't been fully cured, you can go in and freeze the prostate. The problem with cryosurgery is when you freeze tissue, it dies. And it's hard to control the ice ball when you freeze prostate tissue. And so when you freeze nerve tissue, the nerve dies. And so if you're impotent after cryosurgery, I'm sorry, but GAINSWave's not going to work for you. Viagra's not going to work for you. Now, Trimix injection therapy is going to work for you. A penis pump is going to work for you, or a penile implant is going to work for you. Cock rings.
I'd love to take that one.
There you go.
When you, there's two questions on here I'd like to take. One, and then I want you to do the, can he participate in the SWEET study?
Absolutely.
Cock rings. So when you're using a vacuum erection device or penis pump, what you want to do is pump, then let it off, do your massage to erection, go flaccid, pump again, and do this about 13 weeks. And then when you're done, maintain that blood flow that you've pumped into your penis and put a ring around the base of your penis, a cock ring, or what's the technical name for those things? Constriction device. Around the base of your penis. And then leave that blood in your penis for a half hour with that ring on. And there we go, these are good ones. And don't ejaculate, because then you're shooting you're like shooting ejaculation, and then all the blood's rushing out of your penis. You don't want that. You want to hold the blood in the penis as long as you can. So if you decide to pump and then have sex, but don't come. Come later, masturbate later, and come later. And then watch the size of the ring. You don't want to crush the tissue of your penis. You want to have something, first of all, this is a really nice ring because it gives that nerve that runs along the bottom of your penis a little bit of space so you're not crushing the nerve. Remember that all that tissue in your penis is spongy tissue, erectile tissue, and so you can compress it. And if you put that ring on too tight, you'll actually crush that tissue at the base of your penis. So be super careful about that.
Absolutely. So the way that these rings are engineered, there's a cutout for the urethra because the urethra runs at the 6 o'clock position, and there's a little indent that blocks the nerve. Remember, we talked about venous leak. So you can push blood into the penis, but it's going to leak out. And so these little dimples are basically what blocks the blood flow returning through the veins. Now, if you're at the 3 or the 9 o'clock position on either side, you're safe.
Good. So the other thing that I've noticed a number of people saying is, my wife is cutting, we're going to get a that I'm going to get a super dick, or my penis is already large enough, my wife doesn't want it to get any bigger. Really what you're doing is you're restoring the size. If you're not pumping for enlargement and you're just getting a GAINSWave, what you're doing is you're reversing the atrophy that's occurred, and you're going back to your original size where you were the biggest. If you're lucky and everything works and you're getting good blood flow, and you're doing all these, your glory days, right? So it's not like you're going to get this giant penis. However, if you continue to pump after the GAINSWave treatments time frame for enlargement, you can make your penis both girthier and lengthier. So that's really up to you, and you'll decide. A lot of guys who are pumping, they say they get out of the shower and they just kind of like notice their penis in the mirror, and they're like, whoa, I can't even believe that's my penis. So you are in control of that. You're not, GAINSWave and the PRP is not going to do penis enlargement. It's just going to take you back to, hopefully take you back to where you were.
But I do want to put a plug in for the P-Long study. So if you are serious about penis enlargement and you want to participate in an IRB approved clinical research study where we take accurate measurements, and the purpose of the study is to really determine, using the most recent and best technology, how we can grow penises in length, not just girth, but length. Just go to Brandeis, MD, BRANDEISMD.com and sign up for our IRB approved penile elongation study. If you're interested, there are a number of questions on the SWEET study, and this is the brochure for the, that's upside down. This is the brochure for the SWEET study, the Shockwave Erectile Enhancement Trial. If you would like to participate in our trial, this is really the most important development, I think, in GAINSWave treatment in many, many years. And because it's going to give us so many men, to give us so much data that's going to help develop an individualized protocol for everyone. And so you can go on the GAINSWave website at gainswave.com, and there's a little, our SWEET logo on certain providers that are part of the SWEET study, and you can participate in that study and not only help men, but also help yourself, because within a year or two, we're going to have this data and we're going to be able to help you help yourself. And then I also have the SWAP study, the Shockwave and Peyronie's disease. So my Peyronie's disease protocol, and if you have Peyronie's disease, especially if you have a curvature that goes either up or to the left or to the right, please contact my office at brandeismd.com, and we can enroll you in the SWAP study.
Thank you for that. I'm going to make sure I send out an email to everybody about all of those too. And hey, Tim, what was the name of that new cock ring that had the like little divots cut out of it and everything? Giddy. Yeah, giddy dot what? Can you find that URL? There's a really nice cock ring with all the cutouts that's available now. Have you seen that, Giddy?
No, I haven't.
Yeah, that's pretty cool. So that might be a good one. What about Avicen, which increases microcirculation by 68%? I've never even heard about that.
Well, I mean,
what is Avicen?
But that's the great thing about the people out there and patients in general, is that they find things on the internet, and they, most, I wouldn't say most, I shouldn't say that, but a lot of people don't like their patients bringing new information into them or bringing stacks of sheets or paper from the internet. I love it. I think it's great. When someone comes, right after this, I'm going to go on the website and look that up. and try to figure out what that is, because I always want to be 1, 2, 3, 4, 5 steps ahead of what everyone else is doing. I want to be able to provide my patients with the most recent cutting edge. In fact, we just started our patients on PT-141, which is a peptide.
Right.
And it works through a totally different pathway. It works through a melanin pathway in the brain, but somehow it's hooked up with
melanin or melatonin?
Melanin.
Melanin.
So it was
right, because it makes you look tan.
It was used as a sunless tanning agent in Australia, because everyone gets basal cell carcinoma.
I have some in my fridge.
Really?
I've been wanting to talk to you about how I should do it. How much should I inject? And we're going to both try it.
Yeah.
Yeah. Have you guys tried it yet?
Not yet, but I have it in my fridge too.
Well, if you don't try it on yourself first, we're sexual biohackers, aren't we?
I have a funny story I have to tell about refrigerator, because my wife is here. And
he's looking at Anjali right now.
She'll laugh at this. So I used to, I was a roommate when I lived in Los Angeles, and my roommate was an andrologist. So it's someone who studies infertility. And he was doing research on rats and so on and so forth. And so my wife...
Did you have rat dicks in your refrigerator?
Even worse.
What is I thought this was cloves or something.
My girlfriend at that time, who thankfully now is my wife, moved in. She's cleaning out everything, and she's opens up the freezer, and she's like, "What's this? It says rat semen."
That's the kind of stuff we have in our fridge.
Yeah, be careful what you have in your fridge.
We have so many things. We've got oxytocin. We've got testosterone troches. I'm currently trying a new peptide that is zinc and thymus. I'll have to show it to you for hair regrowth. It's supposed to be a peptide that helps with follicular growth. I'll show that one to you too.
So Susan and I, we frequently go to meetings like the A4M meeting, the Sexual Medicine Society meeting, the Aesthetic Show meeting. We're always trying to figure out what the newest, latest, greatest stuff is. And we'd love to share it with you. And we appreciate when patients and really intelligent people share stuff with us.
Oh, that's where I learn all my best stuff from you guys. For sure. You're the best. All right. I have the pump doesn't stay hard. Why? You're not getting a good vacuum seal on it. You may need to trim your pubic hair around the base of your penis.
You need a good seal.
You need a good seal. It's a vacuum. Got to get the suction. I got a couple of things to show you. Can I do it?
Absolutely.
So this is I've got 3 interesting toys.
There's a quick question on the Rocket home use system.
Oh yeah, Rocket. Yeah. That's the one where you're supposed to be able to do it yourself, but it's not even shipping yet as of the time of this webinar, right?
So the first of all, there's a difference between sound waves and shock waves. So honestly, I don't know what the technology in the Rocket is, but it's really important to make sure that it's a true shock wave or an intense pressure wave, not just a sound wave. So there are machines that make noise, but ultimately won't fix the problem. And the other issue is that actually takes some training. I mean, I have nurses, LVNs that are trained to do this in my office, and still it takes them a couple of weeks before they actually get good at it. And so I don't want people to waste their time with home units that they have an expectation that things are going to get better, and they're not necessarily going to get better. And so it may be a good adjunct. So if you get your GAINSWave treatment and maybe have your GAINSWave provider teach you how to use a home unit, but a home unit as a single, as a single entity for treatment may not work. And the other thing is, why are you getting erectile dysfunction? Maybe you have heart disease or vascular disease. So make sure that there aren't other issues or low testosterone before you just jump into a home unit. Yeah.
I understand that there are some men who live in very, very remote areas and there isn't a GAINSWave provider near you. So I do understand that. And I do understand that some guys are just DIY guys. The thing is, I would really look closely at the technology, and that particular device, as I understand it, isn't even shipping yet. They're taking pre-orders, and you have to really trust someone if you're going to give them money for something that you're pre-ordering. And I'd love to see doctors who recommend it first, like doctors who are urologists who choose to do things like GAINSWave. So you may be better. It may be that kind of like, it might be seeming like it looks good in the short run, but in the long run, you would have been better off flying to go get some treatments.
Absolutely. You know, there's a number of questions on the VA, and
Yeah.
I love the VA. I've worked at many, many VAs. I'm a history buff. I love military history. I love our veterans.
Thank you for being a veteran.
Yeah, thank you for your service, and thank you for being a veteran. I have military war hero pictures all over my office, and
You have a great
books
office.
that some of my military patients have given me, and we give our veterans a price break a little bit at the
Great.
office. And actually, one of my good friends is the head of the Palo Alto VA for urology, and I'm trying to work with him on getting some of his patients up to my office to get GAINSWave treatment, because I think it's such an important part of who men are.
Yeah.
What you know, how men feel about themselves, their self-confidence, their connection with their partners. And so, you know, our poor veterans have gone through a lot, and if that's something that I can do for our veterans, you know, God bless them.
Yay. Delayed ejaculation. So as you age, it gets harder and harder for you to actually achieve climax. You lose the sensitivity. That could be one issue. You also could potentially have a diminishment of your semen volume. That could be another issue. There could be prostate enlargement that's making it difficult for you to achieve ejaculation. There are a lot of different issues at play. Do you want to talk a little bit about the lack of sensation and delayed ejaculation?
Well, a lot of those are just really nerve issues.
Yeah.
And especially men with diabetes or any sort of severe neuropathy are going to have diminished sensation to the penis, and that's going to result in delayed ejaculation.
Yeah.
Fortunately, it looks like you have something that might help.
Well, I think that GAINSWave is still, and nitric oxide supplementation are probably still the best things that you can do to try to increase your sensitivity and get that blood circulation and that nerve sensation back. But there's also adding extra stimulation. That can sometimes help you get over the edge. And I know that for a lot of husbands, when they're not able to ejaculate, their wives take it personally. Like, oh, I don't turn him on anymore. You know, she worries about that. So you do have to assuage your woman's, you know, concerns in that way. And no, you know, I know men are usually men of few words, and they don't like to say things. But if you are having delayed ejaculation, sometimes novelty helps. Sometimes just having sex in different places. I think it's a neurotransmitter pathway of some kind. Again, this is just a guess of mine and talking to a lot of different men. But sometimes just changing it up and doing new things can help you achieve an ejaculation. The second thing is prostate stimulation. So prostate stimulation can be done internally or externally. If you go up underneath the testicles and you press the perineal area, some people call it the taint, but I don't think that's a nice sounding name, and you press up in there and you stimulate your prostate from there. The prostate is called the P spot in men, like we have the G spot for women, and it's a pleasurable area. And so you can either just kind of do a reach under and stimulate your prostate through your perineal tissue, or you can use a male toy like this. This is the Duke from Fun Factory, and this has a vibrator. Probably hear it. It's a very powerful bullet vibe on this particular product that's quite nice. And what's nice is it's not batteries, it's rechargeable. And this goes up inside. This is the part that goes up inside, and then this tucks around your perineal area. So you're getting a combination of both external stimulation of the perineal area as well as internal stimulation of the prostate gland. And then there's this, which is called the Tenuto from Mystery Vibe, and it has a Bluetooth controller, an external
you don't
Bluetooth
want the Russians hacking into that.
an external Bluetooth controller. And what's nice about that is that this is both a cock ring, so you get your penis or flaccid, put it on, and then you get an erection, and that goes, your penis comes out here, and this part goes up underneath and rests on the perineum. And this has a vibrator. I don't have my glasses on. I might not be able to turn this on without it. You can do it with the app. But this part vibrates your perineal area, while this part traps the blood in your penis. And this whole thing transfers vibration everywhere, including up here, which is nice because as you're making love to her, this is touching onto her clitoral tissue. So she's getting some of that vibration as well. And it's infinitely programmable, which is nice. And then there's one more I have here. This one is from a company called Hot Octopus. So the 3 companies that I work with, because they have high quality medical grade silicone, they are really good companies to work with. They answer their telephone. They're very innovative. This is the 3rd company. So the first one was Fun Factory Duke. The second one is Tenuto from Mystery Vibe. And this is the Pulse Duo from Hot Octopus. It has a remote control for her. And this is actually, this has a little plate that vibrates, an oscillation plate that vibrates here. And you can wear it like this and vibrate what's called your frenulum, which is basically your clitoris. Your version of the clitoris is right under here. So it will vibrate that, or you can flip it around and the Pulse Duo has a vibrator up here as well, so that she can just get on top of you and you can kind of be in cowgirl position or reverse cowgirl, and she can ride on top of you and ride on this vibrator while you're feeling vibration on your penis, and she can control her vibe over here with this little hand device. So
there are 2 remote controls?
No, this one is just an on-off on the side.
So what about couples that fight over the remote control?
Well, I think you're going to have a problem. So these are some interesting new toys that are worth looking into for a couple of reasons. Number one, they spice up your sex life. And it's interesting. I just did a survey of people rating themselves on their sexual skills. And one of the top things the couple said that both men and women rated that they were the lowest at doing, like the worst, one of their lowest skills was integrating toys into lovemaking. So people are kind of used to them as maybe solo devices, but not integrating them into your sex life. And novelty is one of the things that you need for orgasmic pleasure, and you need the excitement of new things in your sex life. And so I just wanted to show you these today because you might not be aware of some really interesting products. Good. All right. So
wow, we have 261 people hanging in there.
Robert, I know you guys are amazing. Robert said, great idea with the toys. What if you can't get hard to begin with? Well, you're going to go get your GAINSWaves, but then the Hot Octopus is the one for completely flaccid.
I have a number of patients in my practice who have a very satisfying sex life, but are unable to have penetrative intercourse.
You can still have orgasms. You can still enjoy yourself. You can still do tons of fun things. This one works flaccid, not hard. You can use it hard, but it's made for flaccid. This is made for people who are never going to be able to gain an erection again unless they go with your implant, which I love. Yeah. All right. So let's see. John says he's got the Pulse Duo from Hot Octopus. He says, OMG. Good. I'm glad. I know it's made for men. That's for sure. They actually discovered the oscillating pad with men who were wheelchair bound and were unable to ever gain erection again, no matter what they did. All right. I think, have we answered all your questions, you guys? How are you doing? Are you ready to let us go? We're going to go have, some pasta and some homemade salad, my yummy salad dressing, my anti-Viagra salad dressing, which is organic avocado oil, organic olive oil, good red wine vinegar, tossed up together with some mustard on your salad. Tastes delicious. You'll be eating your good organic veggies in no time and getting rid of all that French fry plaque, all that barbecue plaque out of those veins.
4 pounds of watermelon.
4 pounds of watermelon.
6 beets each.
Yeah, I have beets.
And a little bit of ginseng.
Oh, there's going to be beets in that salad. You bet. I always eat raw beets right in my salad. They're so good for you. All right. Well, I think we are complete, and we are wishing you all a wonderful, wonderful rest of your day. Thank you so much for hanging in there with us. We really appreciate the opportunity to tell you about all of the things that we see working for other men like you. And we love and appreciate your kind attention and time that you've given us.
Absolutely.
If there are unanswered questions, send them to me, and I'll make sure that I send things to Judd. And don't forget to use your promo code BETTER if you're going to go get your GAINSWaves. And we'll look forward to seeing you on the other side. Have a great day, and thank you so much. And thanks to GAINSWave team, and thanks to Tim, and thanks to Anjali, and thanks to everybody, because even though Judd and I are sitting here, there's a lot of people supporting us in being with you. So
and
take
thanks
care.
To Susan.
Thank you, Judd. As always, thank you so much. You're the best. I love working with you.
Absolutely.
See you on the other side.